Millions of Americans are struggling with long-term symptoms after contracting COVID-19.
It's known as post-COVID syndrome, or you've probably heard the term long haulers. That's them too. And according to researchers at the Brookings Institution, it's not only plaguing the health of those who are suffering from it, but actually contributing to the nation's labor shortage as well. That study from Brookings finds that 1.6 million Americans are missing full-time work because of this condition.
According to the Centers for Disease Control and Prevention, long haulers can experience a range of issues such as fatigue, shortness of breath, chest pain, and even depression. People with pre-existing conditions can face even more debilitating symptoms. Health experts say it is unclear what causes it.
Charlie McCone suffers from post-COVID syndrome, and in fact, he's had COVID not once but twice.
He's featured in a recent CBS News article by Money Watch reporter Amy Peakey. It's called Living and Working with Long COVID, and he compares himself to a cell phone battery that is constantly dying. Charlie McCone joins us now to discuss his condition.
So, Charlie, that's a heck of a metaphor there, a cell phone battery that is constantly dying. Tell us what it is like to suffer from this condition. And also, I am curious, do you feel you are sufficiently recognized by the medical community? When you report these symptoms, is it something that doctors can isolate or test for and then treat?
No, and those are all good questions. But, basically, I just turned 32, and I've been sick with long COVID from a mild infection my entire 30s. And I'm at a point now where I'm severely disabled. I'm housebound. I need people to take care of me for my daily activities. I can no longer work. And I used to be somebody who was biking 10 miles a day, running 10 miles a week, and working full time. I was in the prime of my life. And right now, we know this is happening to 10 to 30% of folks who are catching this virus. That's now been replicated in over 81 different studies in 20 countries across the world. Dr. Fauci has just acknowledged it. And it's still not clear that the public is aware that this is a possible outcome for them if they get sick. And so it's very critical that we start measuring this pandemic, not in just hospitalizations and deaths, but also in disability, because as you've just mentioned, it's going to have an enormous impact on the workforce, and it already is. And as far as the medical community, they are still considering this a mystery. And I feel like they have been preoccupied with acute illness. But I think we need to start treating this illness the same way we were treating the urgency of vaccines. We need an Operation Warp Speed for long COVID. People weren't afraid to get polio necessarily because they thought they were going to die. They didn't want to be disabled by it. And I think that's going to end up being the same thing for COVID. So it's critical that we start warning the public that this is a possible outcome for their health.
Charlie, I'm sorry to hear about the symptoms that you are still dealing with and battling, as you said, in the prime of your life. You applied for short-term disability, but that was denied. How did you end up getting help? And what advice do you have to the people, like you said, in that sort of 10 to 30% range who are experiencing those long-term symptoms of COVID-19?
Yeah, I'd say first and foremost, you need to my biggest regret is just not taking the time off I needed immediately. When I first got sick, I was assuming, well, it's been 4 weeks, I'll get better. Oh, it's been 2 months, I'm going to get better. I kept pushing through my symptoms, and I pushed through my symptoms for a year and a half until I collapsed. And then I could not work. And during the first year, I tried to get short-term disability, but then I was denied, and the appeal process was so complicated that I said, I can't deal with this anymore. Finally, I found another doctor who was in horror that I'd been working through my own symptoms. He worked very close with me to make sure I could get on short-term disability. So I think the first and foremost is try to find a doctor who understands this condition and believes you and understands how disabling this is, because they are going to be your best advocate. And then other than that, I don't know what to say. I know many people with this condition who have been denied short-term disability, and I don't know that there is much they can do. I know that we need to start acknowledging this condition in terms of supporting people who have come down with this illness. And there isn't a clear diagnostic yet. There are a lot of promising leads, but we need, treatment and we need support, and we also need to warn the public. And so I don't have the best advice of how to get on short-term disability other than finding a doctor who really believes you and understands how disabling this is.
Yeah. Charlie, as I understand it, you are expected to be, or due back, I guess is the term, to work next month. What do you do for a living, and do you think you'll be ready when next month comes around?
I don't know. And that's the insidious nature of this disease, is that you may have a few good weeks and you feel like, okay, I think I'm doing well. And then out of nowhere, you are just slammed back. And it's not clear why or what, but it is very consistent across the board with everybody who experiences this. So everything is wait and see right now, and I will have to check in with my team in March. I really want to get back to work. I really want to get back to my life. But at this point, after 2 years, I've had to learn that the only thing I don't know, the only thing I know is that I don't know.
So, Charlie, this reminds me, this conversation we're having reminds me of a conversation that used to happen around Lyme's disease before there was good research supporting it. People were complaining about fatigue, and there was a kind of like, really? Right. Are you that tired? Yeah. There was a suspicion maybe there's a psychological, there could be a psychological component to it. And, as a side note, psychological illnesses can be debilitating as well. I'm just curious, when you hear people, I'm sure you're aware that there are people who'll be watching this or in your own life talking when you're not there saying something's going on with Charlie and it's not physical. What do you say to that?
I say two things. One, a lot of people have to embrace a lot of avoidance coping mechanisms to get through this pandemic. And I'd say if that's what you're going to do, good luck. And number two is take a look at any of the now over 100 papers on long COVID. It is very clear there is a biological mechanism to this, and it is all related to a demolition of our vascular system. And all of these papers are relying on biological diagnostics that aren't available in the clinical setting. So it is very clear, anybody who is studying that this is a very rare vascular disease that people are experiencing, and is very, very debilitating. And any doctor, any researcher who has been studying this is very aware that this is a real biological disease.
Well, Charlie, good luck to you and your family. I see you wearing the dad cap, so all the best to you. Charlie McCone, thank you.
Thank you.
Thank you.